Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are excited to welcome a very special guest, James McLoughlin, the Director of Partnership for TAP. Thanks and praise. Welcome, James.
My absolute pleasure, Lance. Thank you for inviting me.
Our pleasure. Welcome. So, James, let's start off with kind of what your role is with Thanks and Praise, or you also have the abbreviation TAPS, and what it is that TAPS and, Thanks and Praise does.
Absolutely. So you're quite right. We have an acronym TAP, and it stands for Thank and Praise. And TAP is designed to be a free-to-use thanking platform. As simple as that. It's designed to make it as easy as possible for people around the world, really, to say thank you to key workers. It's a digital platform, therefore people can thank people on the move 24/7. And my role is really to evangelize about TAP's platform and to promote the fact that it's free. It's been proven over the last 3 years. It's very accessible, and we would love anyone listening today who represents a care organization to adopt TAP's platform free of charge for their own organization.
So let me understand. So this would be something like if you're working in a care home or a hospital or a home care company and you want to thank either your staff or maybe you're the family or the recipient of that care, they could use Thank and Praise to then recognize that individual or those people that they want to give thanks and praise to.
You're quite right. What we're about is amplifying the good stuff and sharing positivity. We know that every hospital, healthcare organization, care organization, of course, has its own feedback loops, its own compliments and complaints procedures. What we're really interested in is harnessing the positive messages that do come regularly from friends and families and from those people who are receiving care as well. And to your point, all they have to do is go onto our website, thankandpraise.com, fully set up for the USA, you'll be pleased to know, or go to the TAP store and download an app. And they go on to the website or the app, and they select the organization, they select the care home that's signed up to TAP, or the care organization. They say whether they want to thank the whole of the care home or the care association, or it might be they want to just thank a small department, or it might be an individual. Then they write the message of thanks, and literally that's all they have to do. It takes about 2 minutes. You'll be pleased to know, because we are passionate about positivity, all messages are reviewed by a human, just to make sure that everything that goes up on the public-facing thank you wall for the organization is entirely positive. And because we're very keen to ensure that everything is adhered to from a sort of data protection perspective, if somebody wants to give thanks anonymously, they can. And if someone would rather give the thanks privately, they can. As a small footnote, the point of TAP is actually around public affirmation. We get a very small percentage of people that don't want their message to be publicly shared and seen by the person being thanked, and also their wider colleagues and community.
So, James, just out of curiosity, let's say that we wanted to send you a thank and praise today. Obviously, you're probably on the platform since you're a part of it, but what do you need both partners or parties to be on the platform? So can you thank somebody who may not know about thank and praise? How does that work?
Yeah, so we've designed it to be as simple as possible. So there's no registration required. So if I pick, so obviously you can tell by my British accent that we're based in the UK, although we are moving into USA, and we've already got a presence in Australia. But the idea is that if I was being thanked in the UK, so let's say you were thanking me, you're quite right. I have got reference to the platform, so that message would be seen by myself. So what we're trying to do, and thank you so much again for the opportunity, we're trying to spread the word as much as possible.
Yeah.
That if anyone listening who represents a care organization who wants to have their own branded thank you ball, so it basically would be thankandpraise.com/care home XYZ. And it does mean that then if that care home is registered with the TAP application, it means that when someone gives a message of thanks, they can scroll down or they can start to type, see the actual care organization that they want to say thank you to, and away they go. If the message, if the organization is not registered with TAP, bearing in mind individuals don't need to register to say thank you or to receive thanks, then we put it up, Lance, on our overarching thank you walls. We have one for education, one for healthcare, and one for social care. And then we have a team, believe it or not, that actually reaches out to the organizations where that person works. And it's part of our onboarding strategy. So if someone is thanked for being a brilliant care professional in a care home in Scotland, we will seek that organization out, speak to the manager, ensure that message is passed on, normally through email initially, and then we encourage that care home to adopt TAP for themselves. So that's basically how it works. And the other thing as well, which I would say, is that we do use social media a lot. So if someone is thanked for a particular care home or care organization, then if that organization's got Facebook or Twitter or Instagram, we can obviously share it through that means as well. But ideally, it's better if people are signed up to get their organization to sign up to TAP. That's what we're really hoping to do, get as many possible.
No, it's wonderful. So where did the idea for Thank and Praise come from? How was it created? What started this?
Yeah, so it's a question I get asked a lot. And the first thing I would say is that, believe it or not, it's a pre-pandemic solution. So it was actually early in 2019. The key founders, Sandy and Philip Curtis, decided that enough was enough, and they were going to do something about this problem that they'd seen over the past probably 15 years. At this point, they had a couple of kids adopted. They'd now got a third adopted kid, but the eldest, Donnie, had had special education needs throughout his years. He also had to have surgery. And of course, being part of the adoption program, they touched social care. So they'd actually touched education, healthcare, and social care in his first 18 years. And their sense was, and I'm sure it goes for the Americas as well, but in the UK, they felt that overall the service had been excellent, absolutely excellent. And yet, the media in the UK tends to focus on the negative aspects of healthcare or educational social care. And their very real sense was that while it is absolutely right for organizations to, appreciate what they could do better, they felt it was leaning too much towards constructive criticism, feedback loops, complaints, and there weren't enough clear signposts to say thank you. Even today in the UK, if you go onto a hospital website, for example, it's very difficult to find the compliment button, but you can sure find the complaints button.
So who would you say overall benefits from TAP? Would it be the recipient or the sender, or both?
So when I joined TAP and TAP's mission 3 years ago, my very basic assumption was that TAP would benefit the key worker, whether that's a teacher, a health worker, or a care professional, and that's pretty much it. And I thought, well, that's a pretty good thing. I'm in. What I really hadn't appreciated was the extent that it makes such a big difference to those who are saying thank you. I've heard it for myself. We've interviewed a lot of people in the thanking communities, we call them. A very strong example, perhaps in the healthcare, actually, I'll pick. We interviewed a lady who some years before, 10 years before, had life-saving cancer treatment. And she said that when she left the hospital set up 10 years ago, and the same can be said for now, she said she left in a bit of a rush. She didn't quite say the thank you she wished she had done. And she sort of harbored this regret over many years that she'd never actually be able to say a thank you, a proper heartfelt thank you. And of course, as she said, as the years went by, she became more grateful for the years she had to see her grandchildren go up. And in the end, she became the centre of a BBC television news article that I also appeared on with her, and she was telling the BBC journalists that without TAP, she would have just continued to have felt slightly guilty and slightly um, disappointed that she could never actually share this thanks. So not only was she able to say thank you on the platform, we passed the message of thanks on to the hospital involved, and she even shared it on national news. So that's kind of a significant example. But we honestly get the feeling that on a day-to-day basis, thankers, whether they're patients in hospitals, residents in care homes, friends and families, they feel so grateful that they can actually share a message of thanks with the individual or the groups that have cared for them or their loved ones.
Well, and I think too, and I can see this, James, where, you know, this woman, let's say she wanted to thank a key nurse or a key physician, but even if those were the two that were the recipients, I think it would kind of benefit the entire team, right? Because they're seeing that people do care and it is appreciated. And it just, I think, would be a good morale booster for the whole team or the facility by itself. You know, when you see you're getting recognized, because you're right, far too often we hear the negative or the bad side or, you know, the things that don't go right, but rarely is it the story where you're hearing about how things did go right.
I couldn't agree with you more. And actually, to bring the TAP platform to life, I guess, on your podcast and so on, I thought I'd read out maybe at least
Please.
one or two messages of thanks during the course of this conversation.
Well, I'll let you know you're stealing one of my questions. I was going to ask you, are there any key thanks that or praise that really stand out? Yeah, please share those.
Yeah, so this one I picked up on specifically from what you just said, because we get thanks all the time. Obviously, we've had tens of thousands of thanks for individuals, for teams, for whole organizations. But this one really stands out. It's for Ashley Court Care Home in a place called Poole in Dorset, Sleepy Pool in Dorset. To the whole team, which includes the carers, housekeeping, kitchen, activities team, and office staff. Keep the fantastic work up in these challenging months that we've been having. You're protecting the loved ones of those we trust and staying in your care. And we know that as a result of that, you're not seeing your own loved ones because the job that you do, you are all amazing. And we see this all the time where people are connecting the dots. They're not just talking about the front-facing care staff. They're talking about the people that support their loved ones in the kitchens, around the whole site, basically.
Well, absolutely. And, you know, it's kind of like a car. You know, the engine is very important and the tires are important, but so is the windshield wipers and the doors, you know, and it takes all of those parts to make the car run and operate and to be safe. Just like with facilities, you know, the physicians are important. They all have that key role. And without one of the roles, it can't be as successful or beneficial as possible.
I totally agree with you. And the other learning I've had over the last 3 years is that the TAP platform was created as a way to allow members of the public to more easily say thank you to key workers. What we hadn't envisaged, what I hadn't envisaged, was the level of usage peer-to-peer, key worker to key worker. Obviously, there was a lot of that during lockdown when teams were working in isolation or different time shifts, in bubbles and so on. But we've seen this continue as well. And we think this is a really important element. And again, one might think that prior to TAP, there were lots of different ways to say thank you to a key worker. A peer who was also a key worker. It could just be a WhatsApp. It could be an email. It could be a text. It could be a bunch of flowers. It could be a card. And what we've realized is that TAP within an organization is starting to stand for something bigger than simply a message. It's becoming this sort of place that people zone in on, you know, so when they've had a tough day at the office, or in this case, in a care organization, which can be tougher than an office, they'll come back home, they'll look at their app, and they'll scroll down and see the messages of thanks. And to see one from someone in the public, great, but also to see one from your manager or from your co-worker also means a huge amount. And we're seeing an awful lot key worker to key worker thanks.
That's wonderful. So being in the UK, and so I need to ask this. If, let's say somebody wanted to send the royal family a thanks or a praise, how would you guys attempt to reach the royal family? to
So
pass that?
yeah, that's a really, really interesting question, and I've sort of got a cute answer. Um, first of all, we are dedicated at the moment in the education, healthcare, and social care sector.
Okay.
Although, in a way, by popular demand over the COVID period, we created a kind of another key worker arena for those who work in retail, who work in grocery stores, and so on and so forth, because they became the heroes of the hour as well. Back to the royal family, and obviously, God bless Her Majesty and so on, the Queen Elizabeth. But we've now got a new king. But what I was going to say is that we are the digital platform behind something called Thank You Day in the UK.
What?
And it just so happened that Thank You Day took place in happier times earlier this year to mark the Jubilee celebration of Queen Elizabeth II. So TAP's digital platform supporting Thank You Day did indeed carry messages of love and affection and support for the Queen and the royal family.
Wow.
We did not pass them on in a scroll and send them by pigeon to the royal palaces. But as I say, that's probably an exception. And I think when people say thank you to the royal family, they're expressing it to be seen by a wider public. And we had a lot of shares on social media, and a lot of coverage in the media off the back of that. But yeah, no, we love to help out whenever we can with our platform.
That's tremendous. Well, I think the work that you guys are doing with TAP is desperately needed because, again, with us being in the healthcare industry and the home care industry, far too often they're almost an afterthought. And I know, speaking to mutual friends of ours, Adam Purnell and Mark Tops, who have a remarkable show themselves during COVID.
Absolutely.
Yes. And, during COVID, these frontline workers at the hospitals and the nurses, all the way down to the, direct care workers, the care homes, they were definitely being given their due credit and being supported. But then it was like slowly forgotten afterwards. And some people, we had one guest on who said, I felt like a hero, but now I feel like I'm a zero. And they will, they'll remember that. But and then to get a message from, TAP, thanking them and praising them, letting them know you and, your team, they're all doing good. And we appreciate everything you're doing and, the work. Because like you said, care homes and healthcare oftentimes is a lot more difficult, demanding job than working in an office setting. And I think it's great to remind them that they are needed, they're valued, and they're appreciated. But the same with your teachers and, all these other, fields. And I think you guys have a wonderful thing here where you're helping communities in these valuable parts of our communities feel appreciated and know that they're appreciated. Have there been any thanks or praises that have really, and I know you read two beautiful ones a few minutes ago, have there been any that really have touched you or really stood out where you said, wow, we're doing something remarkable here?
Yeah, absolutely. And to your point around this sort of outpouring of gratitude during the pandemic, of course, it was around the world. It was in the USA, it was in Spain, it was in Greece, it was in the UK. But you are quite right. And it's an interesting parallel, this sort of hero to zero feeling, which is just unsettling to hear. One quick stat, and this comes from actually Adam Purnell's institute. He's the director of social care, as you know, the Institute of Health and Social Care Management. We carried out a survey just a few months ago, and sad as it may be, that 86% of care professionals in the UK still don't feel recognised for what they do. So we know this outpouring of gratitude, this clap for carers piece, needs to sort of metaphorically continue, and we hope that TAP is one of those vehicles that can do that. And the other point as well is around continuing this level of gratitude and thanking. Every single week, we hear reluctant heroes, care professionals who say, "But I'm just doing my job." They don't realize, they forget actually how special they are. So, and everyone likes to be reminded. So back to one of the thank you messages. A special thanks to Caroline Hurry, who not only cares for her mother, who has dementia, but she's also a carer in the community. She has worked throughout the pandemic and has been the only contact that some have had, even during their end of life care.
Mm.
And this is a very moving message of thanks, obviously at a very personal level. But you know yourself, you work deep in the industry, in the sector. You know that these people during the pandemic were the lifeline, quite literally, for hundreds of thousands of people who couldn't see their own families, and in very sad circumstances, they were the last voice, the last hand that people held during their final moments on this planet. So this is an incredible sector that deserves to be applauded at every move and at every opportunity.
Absolutely. Absolutely. So how do you also, I mean, I think we've kind of touched on it, but you also have, I believe, some data that shows the mental health benefits of thanking and praising people. Do you want to share some of that?
Yes. So we've in terms of sort of numbers, we sort of steer away from sort of just using numbers, so to speak, other than stats from surveys, which I've done already. But we're gaining mass adoption from the UK's care associations, which indeed serve thousands of care providers, which is tremendous. But we sort of we I guess we prefer to drill down on the more sort of qualitative feedback, and we collect regularly testimonials from both staff members that have received thanks, but also those that have given thanks as well. So we have that. And to your point around really understanding the connection, we already know, of course, it's been very well proven by the likes of Harvard and co. that there's a very real connection between gratitude and mental well-being. That's very much established. Lance, what you might be interested to know is we are literally, and I'll be happy to share this with your listeners at some other point, but we're literally midway through a comprehensive well-being survey with our TAP user organizations to really understand the extent of change in the environment since TAP platform has been embedded. Wow. And what we're really looking to try and do is understand beyond the well-being and how that has actually affected their recognition and how that in turn has affected recruitment and retention. So this is a bit of downstream research that we're looking to do. But in the meantime, as I say, we're collecting regularly these sort of qualitative testimonials, such as this one from a manager at Dementia Concern, which is a leading UK care organisation. And she simply says, making it easy to send a message of thanks to someone that has been particularly helpful or made your day or someone else's, with all the negativity in the world, is really a breath of fresh air. And it's so good to have a platform dedicated to celebrating the good going on all around the country in social care. And this, I guess, is echoed. So as I say, we know that fairly tangibly that TAP is making improvements in people's day-to-day existence. And Lance, as I say, our major barrier really is just making sure that people know about us in order to adopt this amazing free platform.
Yeah, no, I think it's remarkable, James, and we're so happy to have you on and to share this because it is something that is so very much needed on both sides of the pond, yours and ours. And I know it's just recently become accessible in the United States, correct?
Yeah, so exciting. I mean, look, you are a very, very, very large territory in comparison to UK. But I think as someone said the other day, the UK has been a very, very good sort of testing ground for when we do launch in the USA. We've been going in the UK now for just over 3 years. We're embedded, as I say, quite heavily with large care associations and also working closely with the central leadership team within the NHS, the National Health Service. But we also, about a year and a half ago, opened up TAP within Australia. Okay. And this won't come as a surprise, but their national heroes, certainly the heroes of the moment, tend to be the firefighters and the sort of rural doctors network, those who are able to fly in helicopter around the country supporting rural locations. Sure. So that's been taking off perhaps more in that direction. Our assumption is in the USA that it's going to, and especially with your support, there's going to hopefully be a lot of interest in the health and care sector, and that's really what we're going to be focusing on in the USA. For your listeners today, please do go to thankandpraise.com. It's set up for the USA, and if anyone listening today wants to go on to thankandpraise.com, they can share a message of thanks. At the moment, it would appear on the social care thank you wall, but then my colleagues in the US would then reach out to the organization being thanked, share it, and encourage them to adopt. So please help us to raise awareness and adoption. And of course, if anyone listens today wants to have their own branded thank you wall, which, as I say, it would be an offshoot of thankandpraise.com, again, they can register their interest on the website or through the app, which is Tap Thank and Praise. So absolutely, I would love for the USA to flourish as a direct result of our conversation today.
Absolutely. And we're going to have the link, thankandpraise.com, in our show notes and up here on the screen for our listeners and viewers. And
amazing.
We're happy to help share this and spread the word for something that is just so much needed and really missing from the world today. And that's just appreciation and gratitude for those, serving in whatever capacity it is that they serve in. James, we appreciate your time. We look forward to maybe speaking to you again down the road and hear all the new and exciting things that you and Thank and Praise are doing. Thank you so much for your time today.
Thank you so much indeed. And very much look forward to keeping in touch over the coming months.
Absolutely. You have a great day. Thank you, James.
All the best. Cheerio.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms, or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. Again, we'd like to say thank you to James McLoughlin for joining us today to discuss Thank and Praise. Thank you so much, and we look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.